The coronavirus infection surging across much of the U.S., including Southern California. The L.A. County, well, they're moving to implement new restrictions, including curfews, in an effort to reverse what officials are calling, quote, a very dangerous point in the pandemic.
Let's bring in the director for the Los Angeles County Department of Health Services, Dr. Christina Ghaly. Dr. Ghaly, great to see you again. Thanks for being with us. So give us some perspective. What are the numbers like right there where you are? And do you have an explanation for this recent surge?
Good afternoon. Thanks for having me. Yes, the numbers are indeed concerning. Back in September, we were having only 100 new cases being hospitalized a day with COVID-19, and now that number has doubled up to 200, and we're seeing up to 4,000 new cases every day. And it seems to be due to the fact that people are mingling with others outside of their household, maybe are letting their guard down with their mask or not wearing the mask, and just not always following those basic public health practices that we know can keep people safe. And that's what's driving the transmission that we're seeing right now across Los Angeles County.
Would another stay-at-home order help?
Well, we're going to try to avoid that certainly across California and Los Angeles. The public health director in Los Angeles County has just put in place a curfew, 10 p.m. to 6 a.m. There's new restrictions on bars and restaurants and personal care like salons, massage parlors to try to help reduce the transmission. And we've always tried to balance the need to keep businesses going for both employment, economic growth, with the need to reduce case transmission for public health purposes. But certainly if we can't get the numbers down, then I do think another stay-at-home order is possible in the near future.
Of course, no one wants to hear that. And Dr. Ghaly, everyone's trying to figure out how to have a safe Thanksgiving. A lot of people coming home for the holidays and trying to do that with a test. What is the testing situation like there in Los Angeles County? And what are your recommendations for testing your way into a family unit?
We are fortunate in Los Angeles to have good testing capacity with pretty rapid turnaround times. At the community-based testing sites that the county operates, we have results coming back in less than a day, and we have more than ample capacity for anyone who needs a test. So those are the good things. However, a test can't be used as a free pass for getting into a social gathering with people outside of your household. And I would ask people to remember that the test result is really only accurate on the day you took the test. The test result, when it comes back a day later, you could have turned to be positive that day, or certainly the day after that, or the day after that. So while a test is a helpful and very critical part of helping us to curb the transmission of COVID when combined with other measures, by itself, it doesn't necessarily do anything. And so I would encourage people, please don't use a test to go out with your friends on the weekend or to engage and intermingle with people that are outside of your household. More important is to wear your mask, limit your mingling with those outside of your household, wash your hands, and to quarantine and isolate if you do have an exposure to someone with COVID, even if your test is negative, because remember that test can turn positive at any point in the 14-day incubation period.
Dr. Ghaly, we're not going to ask you again what your recommendations are for people to protect themselves. If you don't know by now to cover your face with a mask and wash your hands and keep your social distance, that's on you. But I do want you to speak to people with this fatigue. Speak to those folks who are now just exhausted of it or are done. Make a plea to them for what they need to be doing and why they should continue to do those things. So more of an emotional side that we're appealing to versus people know what they should be doing, they're just not doing it. So talk to those folks.
Yeah, I would say, please, for the people that aren't believers in those practices, first, know they work. There's good data that they work. And even if you haven't personally been affected by the tragedy of COVID, if you haven't had a family member or a close friend die, or you don't know someone who's living with the long-standing sequela of COVID, know that it's real. Know that it's around you. It could affect your family. It could affect those around you. But there are countless millions of people that are suffering because of the loss of someone they love, or the watching the pain of what they're going through. And I would ask that you please do listen to that guidance, do other things like get a flu shot, be careful with your Thanksgiving plans. This virus really is quite dangerous, and we need everybody to do what they can to help stem the spread. If everybody does their part, then we can make a difference in curbing the transmission. And please, I would also just add, don't see the mask as a symbol of what's wrong. don't see the mask as what's holding us back as a society or as something that is the cause of all the problems around us. It's not that. It is the ticket for trying to get through this and out of this safely for everyone in all of our communities. And I hope people can see it as a way to show concern and care for those around them.
That's right. It's a solution, actually. Dr. Christina Ghaly, beautifully and perfectly put. We hope people take it to heart. Thank you so much for joining us today. We really appreciate it. We know you're very busy.
Thanks so much. Take care.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.